Following that introduction of mechanisms for lower back injuries in softball players, I'm going to demonstrate my corrective exercises to improve flexibility where appropriate and core strength appropriately. Working from the bottom up, okay, the first thing commonly you have to address is stiffness or tightness in the quads and hip flexors, which are the muscles in front of the thigh. Okay? If these are tight, my posture typically falls into this position. So I'm already being pulled a little bit into extension due to the fact that the hip flexor muscles, which also double as quad extensors, will cross this area. Okay? And if they're tight, they pull the lower back into extension and they flex the hip, right, leaving my butt back. So to improve my ability to extend the hips and to break through, really, and get motion through the front of the hip, right, I have to stretch out the muscles in the front of that thigh. Okay? The way we do that is with a rear foot elevated hip flexor and quad stretch. Okay? Start putting your back foot up on something elevated. It doesn't have to be this high. It can be on a lower box. You don't even need to elevate it, all right, if you feel a stretch already in this position. With your back foot elevated up on the box, the first cue and most important cue to remain throughout the stretch, focus on, is to drive the knee through the ground. Right? We're not moving forward yet. Okay? We're just thinking about getting length, growing tall, driving the knee into the ground. Right? Immediately you're going to feel a big stretch in the front of the thigh. Okay? If you don't feel a stretch, you can then begin to shift forward slightly. Okay? So first cue, drive the knee down. Second cue, shift forward slightly. Again, do not arch. Do not crank out in this position thinking you're stretching your hip flexors. Right? This is not beneficial. Okay? We want to first drive the knee down through the ground and get tall. Okay? Shift forward a little bit. And then you can then reach up with your right arm. And lastly, lean to the left. All while driving this knee into the ground. I recommend putting a pad or getting something cushioned. I'm on turf now, but if you're on a hardwood floor, this is going to be unbearable. So get a pillow, get a mat down underneath the knee, crush that pad, get super tall. You're going to feel the stretch. Hold it. Okay, 3 times 10 seconds and then switch. And if you're super tight, more frequency is better. Do this 1, 2, 3 times a day, all right, before and after your workouts especially. Okay? Rear foot elevated quad hip flexor stretch. Now, once we gain that motion, all right, in the front of the hips, we have to kind of teach or remind the glutes, the muscle on the backside of the hips, get their ability to drive again and break through that new range of motion. So we integrate the new mobility, right, and then we teach the muscles on the backside to really break through and to coordinate and control all that new motion. And we do that with a hip bridge. Okay? First variation is going to be on 2 legs. From here, push your heels into the ground. Bring your legs up first. Okay? The emphasis is to squeeze your glutes, squeeze your butt. Get control. Feel those muscles working. And lower yourself back down to the ground. Okay? Push into your heels. Squeeze your glutes. Drive your legs up first. And then down. Okay? 2 to 3 sets of 10 following the rear foot elevated quad hip flexor stretch. A progression beyond the 2-foot version to make this more challenging and again more specific is to move to one leg. Bring one knee into your chest and drive your heel into the ground. Bring this leg up. Think all leg. And again, we're preventing extension through our lower back, so don't compensate and stick your belly way up in the air. Focus on the leg movement and on the hip drive. Squeeze the glute and down. You can warm up with set on 2 legs, progress to a set on 1 leg. You can stay all. Keep all of your sets on 2 legs and then progress down the road, all right, when you gain some strength and control. Okay? But that is our strategy for improving flexibility in the hips, for improving strength in the hips, again, to prevent too much motion in the lower back. Next, from the top down, we're going to improve that specific flexibility in the upper back that I described in the first segment. We're looking to gain extension in the upper back where we tend to lose it because of bad posture and bad habits, okay, which will relieve the mobility responsibility of the lower back. Okay? For this exercise, you're going to need something elevated, a box, a bench, a chair, a couch, all right, that you can perform this exercise on. I'm using a dowel or a stick for my hands, but you can also use a towel, right? It'll serve the same purpose. If you're using a towel, you want to pull that towel apart, right? And keep tension on the towel the whole time you do this exercise. If you're using a stick, you won't have to focus on much. Okay? You're going to set up with your knees probably 2 to 2.5 feet away from your box, bench, or couch. Right? From here, have your elbows placed on that, again, that box, bench, or couch. Elbows and hands should be the same distance apart. You're going to sink your chest to the ground in this position. Okay? Don't drop your head too far. Keep your head back. Keep your eyes down. Sink your chest to the ground. I like to hold for 3 to 5 seconds and relax 5 to 10 times, again 1, 2, 3 times a day if you need it. You should feel a stretch in the upper back, okay, around the shoulder blades, maybe even under the armpit into the lat muscles. Okay. That's improving extension through the upper back, okay, so I'm not compensating through my lower back to get this hand in the right position, to get my arm in the right position, in the right slot. Okay, I want to get pure, authentic range of motion through my shoulder. If you're tight here, your body's going to compensate through the lower back and the lumbar spine. We started with hip flexibility, a hip strengthening exercise, the thoracic spine extension exercise. Lastly, a basic plank with some special emphasis, okay, to teach your athletes how to engage their abs properly. It's tough for most athletes to squeeze their abs properly or to get tight or to remain tight in a plank position. Pretty much they'll assume the position and then they'll just kind of hang out without really knowing how to coordinate all of the muscles of the anterior trunk to engage properly. With proper sequencing, really. So the abs are firing as they should, and we're not using other muscles. So what you're going to do is take a mat that you can roll up. You can take a towel that you can roll up, and all it's going to be used for is a cue. You don't need it if the athlete understands what to do here, but I've found that athletes typically don't get this. So at least to start, all right. But use the roll or use the mat roll or a towel roll to reinforce this external cue to get them to engage their trunk properly. You'll find that athletes feel weaker now because they're using muscles instead of hanging out, all right, and compensating. They'll feel they're using the muscles a lot more, but again, you're going to have to reduce the time per set of this exercise because they will appear to be weak, at least to begin with, because they're doing it correctly. You're going to roll up your towel or mat. Have your athletes get into a front plank position. I'll demonstrate from this angle. Okay. Make a fist, as strong a fist as you can make, and then have them try to crush the towel roll. You can see I'm already shaking. This completely changes the exercise. And relax. So you may not need the towel roll to serve that cue. Your athletes may be able to understand and comprehend driving, right, their hands into the ground. But you'll know as a coach or a parent if they're doing it by the pressure you see them exerting onto the mat roll or towel roll. Start with 10 seconds, 3 to 5 times as one set. So each 10-second repetition, or each 10-second interval counts as a repetition. All right, and then slowly increase the time, all right, to 15 seconds and to 20 seconds. All right, it completely changes the traditional plank exercise and makes it more intense. So that's really it for this brief tutorial on at least assessing your athlete's predisposition for lower back injuries and giving them a short little workout, core and flexibility workout, all right, hopefully to open up areas that are commonly tight and strengthen the areas that most athletes really have problems with. And I really hope that the exercise, the corrective exercises, are digestible and easily understood in this throughout the video. If you do have any questions, make sure you post them on the comment section or shoot me an email. I'd rather you have them post a comment because if you have a question, most likely other people have the same question, and it's better that we start a conversation. If you're confused with anything, typically I don't take too many takes to film the video, so if something isn't clear, it's because I'm too lazy to go back and refilm it. These videos are pretty long, I understand, and I appreciate you guys listening. So if you have any questions, let me know. If you have an athlete who is a specific case and you want to shoot me a video, okay, please do so. All right, I'll take a look and do my best to get you a response regarding their specific case. I may even ask to use it as a case study, again, for these learning type video blogs where I can utilize, I can use your athlete as an example for other viewers and to show the types of common dysfunctions that I see that you're having to deal with, and the individual prescribed corrective exercise and how we go about improving that athlete's function. I'm looking for as many case studies and brief examples as I can. So if you have a specific case that that you need a little bit more detail or a little bit more comprehensive approach, make sure you get that information to me. And hopefully we can not only can I help you, but I'll be able to help more people through the site as well. Thanks.